My name is Dr. Julie Maranda. I'm the Physician Chief of Staff at the Hawkesbury General Hospital. As Chief of Staff, I'm in charge of the quality of the medical care provided by the doctors at the hospital, but I also sit on the leadership committee where I have a role to play in overseeing the functioning of the hospital. I come from a family of doctors. I have a physician father, Dr. Claude Maranda, who's a cardiologist, and I have my brother, Dr. Robert Maranda, who's also a cardiologist. My father started here several years before myself, and I was training in Toronto, but wanted to be closer to home, which was Montreal, and decided to try Hawkesbury. He had spoken so highly of it over the years, and it was more than what I expected. When I arrived here, everything he talked about was really true and more. And then I spoke so highly about it that when my younger brother finished his training, also in Toronto a few years later, I convinced him to come join us. So now we have the three of us working together at the hospital. We have our lunches together, we discuss patient care together, and it makes it more like a family and a home, even though I'm at work. Having care accessible closer to home is not just convenient. For some people, that's all they have. It's come up many times where patients have asked to not be sent to Ottawa or Montreal for care and whether or not it was really necessary. And often we try and accommodate them, but sometimes we just can't. And they really do need to go to Ottawa or Montreal for a specialized service that we can't offer closer to home. And it happens quite often that the patient just either refuses or cannot find the means to go, and we're not able to assist them in that, and they've not gotten the care they've received with consequences. I have a patient this past year that was afraid of driving in the winter, and so despite being a diabetic with a wound on his foot, he refused to go to his appointments in Ottawa that we rebooked and rebooked and rebooked, and now he's looking at an amputation. So we talk about patients having to drive to Ottawa or Montreal and take a day off work, spend money on gas, parking, sometimes arrange to get a ride with friends or family. But for some people, they just can't, and it means not getting the care. So there's many, many advantages to being able to offer care close to home from all spectrums of society. The construction project that the hospital is going through right now is a real source of pride for the community. Being able to say that this is our hospital and that we're providing this to our community and the larger surrounding areas is really something that I think we should all be proud of. It's also going to be able to bring in different kinds of programs, different kinds of testing equipment, new types of specialists. So it's going to be able to expand the kinds of services we offer here, which is again reaching care closer to home, which is our goal. The staff at HGH are so hardworking and have such big hearts. It's really part of what keeps me here and what keeps a lot of the doctors here. We really feel like the people that work in Hawkesbury are here because they care. They care about the patients, they care about quality, they care about medicine, they care about healthcare. It really is motivating to work alongside such incredible people. So working in Hawkesbury has not only been a family affair for myself, I also have lots of friends who work with me here. We are over 110, 115 physicians currently, and I can honestly say we're all friends. There's something about being in it together and having a common challenge and a common passion that really bonds, and the engagement of physicians at Hawkesbury is above average. In fact, we've actually tested it. We've done surveys, and if we compare ourselves to other hospitals in Ontario, our physician engagement is extremely high. And I think part of the reason physician engagement is so high is because we are able to provide them with the tools needed to do their job. And the foundation and the money that the donors donate is incredibly essential to that. Without that equipment, our engagement would not be so high. And we know that physician engagement leads to better quality of care, more efficient care, even cost savings. So all around, it's win-win. I'm a donor to the HGH Foundation. I've given my own personal money to help build this hospital because I believe so strongly that this is a very special hospital. I really believe that what we can offer in Hawkesbury is beyond what can be expected in the cities. I've worked in probably almost 20 hospitals throughout my training, and there is something special about this place. I want to be able to continue that for future doctors and nurses and staff to be able to continue to work in a place like this. But I also know that this is where I come for care and my loved ones come for care. And I want them to have the best equipment and the best supplies in the most timely manner. I've brought my mother here. I've brought my son here. I've brought my family. I've brought friends. I've brought neighbors. So for me, this is the place to be. And I want to make sure that we have everything similar to the big cities.